Okay.
Perfect. Okay, hello everybody. Welcome back to Invisible Disability Education and Advocacy Association. Today's topic will be about brain injuries. So, what is a brain injury? Brain injuries are classified as any form of damage or harm that is dealt to the neurons of the brain. There are two types of brain injuries that we'll be covering. First is acquired brain injuries. So ABIs, acquired brain injuries, refer to any damage to the brain that happens after birth, isn't congenital, and is not related to degenerative disease. So non-traumatic brain injuries could be caused from multiple things. So some examples include aneurysms, brain tumors, cerebral edema, encephalitis, hydrocephalus, hypoxia or anoxia, meningitis, opioid overdose, or stroke.
Traumatic brain injuries refer to something that happens outside of the body. So this could mean assault, combat injuries, falls, motor vehicle accidents, shaken baby syndrome, or sport injuries. Traumatic brain injuries are classified as mild, moderate, severe using the Glasgow Coma Scale. This Glasgow Coma Scale is a neurological scale aiming to provide a reliable way of recording the conscious state of a person. So it is important to note that the Glasgow Coma Scale, as a method of measuring consciousness, must be combined with other variables to accurately measure the state of individuals, since the brain's different regions work together to produce alertness. Therefore, all faculties must be accounted for and considered.
So an acquired brain injury can impact people in many ways, including behaviorally, cognitively, emotionally, and physically. For behavioral changes, following an ABI or acquired brain injury, impacted individuals may be more impulsive than they were before or may act differently in social situations than they did previously. For cognitive changes, changes in cognitive abilities can occur, such as attention and concentration, judgment and problem solving, language and communication, memory, planning skills, and self-awareness. Changes in emotional processing can also occur, including how emotions are experienced. Individuals may experience an increased frequency in emotions and feelings such as agitation, anger, and irritability, or may frequently jump between these emotions. Some of these changes may resolve a few months after the injury. There are also emotions associated with acquiring a brain injury, as with other major life changes. These can include sadness, anger, denial, nervousness, or anxiety. Finally, the most common physical changes following an ABI or acquired brain injury are fatigue, chronic pain, mobility difficulties, and headaches. Others include ataxia or jerkiness, balance problems, headaches, impaired motor control, changes in muscle tone, paralysis or weakness, and changes in the perception of sensory information or other sensory problems.
So when it comes to treatments and care, individuals with acquired brain injuries can receive care from a variety of professionals. This includes physiotherapists, occupational therapists, recreational therapists, and other mental health professionals such as social workers, psychologists, and behavioral therapists. Other treatments are focused on the cause of the acquired brain injury. So this is supportive treatment following a motor vehicle accident or a shunt from hydrocephalus.
So, what are some issues people with brain injuries face? First, there's stigma and misunderstanding. The lack of awareness and understanding about brain injuries can result in stigma and discrimination. Others may not recognize the invisible challenges faced by individuals with brain injuries, such as cognitive impairments or fatigue, and the misconception that individuals with brain injuries are fine or back to normal after a certain period of time could lead to unrealistic expectations and added pressure. Employment and education challenges. Difficulty re-entering the workforce or continuing their education due to cognitive impairments or physical limitations, and the discrimination or lack of accommodations in these settings is one of the issues that are faced. Lack of accessibility and accommodations. These can pose significant challenges for individuals with brain injuries, impacting their ability to participate fully in society, access services, and maintain independence. Boundaries are a recurring theme for our discussions, as you'll see here. It's important to set boundaries with people in your life and to let them know what works for you and what doesn't for you. But we also need to consider that we have to set boundaries for ourselves. And this goes for everybody with a disability. Allow yourself to say no to things, and saying yes is not always a good thing for your own well-being. Allow yourself time to catch your breath, and don't let the fear of missing out or disappointing friends lead to severe burnout. And similarly to physical disabilities, it's hard to get used to using aids. Sometimes you're afraid if someone will look at you funny, or maybe just being noticed can bring you discomfort, particularly in a setting like a school, which is a place that's large enough to always feel a little unfamiliar and it always has new faces. It's really hard to get through each day of classes. But sometimes some physical aids are all it takes to make everything a little easier. The thing about this place being so big and full of different people is that everybody's in their own world, and nobody's really paying attention to you nearly as much as you may think. So, what can we do to help? So, first, we have to raise awareness. Increasing public awareness about brain injuries and their impacts on individuals and families. Educating the public about the causes, effects, and prevalence of brain injuries through campaigns, events, and social media, and sharing personal stories and testimonials to humanize the impacts of brain injuries and highlight the challenges individuals face can all help alleviate the pressures faced by people with brain injuries. Next, we can support legislation and policies. We need to advocate for legislation that protects the rights of individuals with brain injuries, such as laws ensuring access to healthcare, rehabilitation services, and educational accommodations. Next, we can promote accessibility. Advocating for improved accessibility in public spaces, transportation, and workplaces to accommodate for individuals with physical disabilities resulting from brain injuries, and supporting the implementation of assistive technologies and devices that enhance dependence and quality of life are ways we can help. We can also promote inclusion and accessibility in education and employment. We need to advocate for educational accommodations for students with brain injuries, such as the individualized program plans, also known as IPPs. We also need to encourage employers to provide reasonable accommodations, flexible work arrangements, and job training programs for individuals with brain injuries. And lastly, we can support associations raising funds for brain injury research, treatment, and rehabilitation, such as Brain Injury Canada. You can scan the QR code here to go to their donation page.
If you are curious as to how go about getting accommodations or whether or not you qualify, you can check out the link on screen where you can inquire further. We'll leave that up for a second in case anybody needs to get a picture of that. And for other supports on campus, if you're looking for those, they are on the screen as well. And if you have yet to join our Discord or join through the Club Hub, you can check out all of our links here, where you can join through our website.
Perfect. Thank you guys so much for joining us for our seminar on brain injuries, and stay tuned for next events, including fundraisers and the next seminar.